Anorexia nervosa is an eating disorder known for underconsumption. Bulimia nervosa is another eating disorder that is characterized by binge eating and purging of food. People suffering from anorexia nervosa often suffer from slow heart rate, low blood pressure, low body temperature, and anemia, while people suffering from bulimia suffer from irritation, inflammation of the esophagus, vitamin and mineral deficiencies, electrolyte imbalances, dehydration, and acid reflux. People suffering from eating disorders typically have distorted views of their own body, seeing themselves as much fatter and less attractive than they actually are. Anorexia nervosa takes an enormous toll on the body, but that's not all. It has the highest death rate of any mental illness. Between 5 and 20% of people who develop the disease eventually die from it.
A recent study was conducted in an attempt to show if there are any differences in size of brain structures in the brains of people who are suffering from abnormal eating disorders characterized by underconsumption of food. Okay. The study categorized both bulimia nervosa and anorexia nervosa under the same category of an eating disorder and created two groups. One with a restricting type of an eating disorder, while the second group was a control group of people of healthy weight with no history of eating disorders. To measure and compare the size of brain structures between the two groups, a VBM, which is an MRI technique comparing gray matter volume, was used. Cross-sectional studies of people of healthy weight and people with anorexia nervosa comparing the entire brain was also used.
The results show that women with anorexia nervosa had a large drop in global gray matter in the brain, along with another large drop in white matter. People with restricting eating disorders also show signs of increased amounts of cerebrospinal fluid in the central nervous system. Additional analysis concluded that the hypothalamus, parietal lobe, right-left form nucleus, and right collocaudate all showed signs of decreased gray matter. These results mirror the types of brain degeneration seen in elderly people. Decreasing amounts in gray matter and white matter in these parts of the brain also affect memory and cognitive functioning.